Everybody, thank you so much for your attention this morning. We try to pack so much into the morning portion of our FTD Education Day because we want you to be the ones to have access to that scientific, that very deep knowledge about what you're going through and your loved ones are going through. And now is the time where I want to talk to you about how you can take action to support that important work that our scientists and researchers and staff are doing. So I want everybody to take out your teal bag and get your program book out and turn to the last page. That's right, make some noise. Look at this. I took the 5-minute warning, but I know that I'm the only thing standing in the way of lunch, and I'm going to keep that in mind. Okay, get out your program book, and while you're doing that, many of you know that my role in the FTD unit is the Director of Caregiver Support Services. And I came to this role through a personal experience. Here we have a picture of my husband Mike and I on our wedding day and our son Noah. Many of you know that my husband Mike was diagnosed with behavioral variant FTD at the age of 29. He was so lucky to have Dr. Dickerson as his compassionate clinician. And on April 19th, 2012, at the age of 33, just over 3 years after his diagnosis, Mike passed away. That was 21 days after our son Noah turned 4, and only months before we might have celebrated a decade of marriage. And that experience of being Mike's wife, caregiver, advocate, friend, partner, soulmate, that built up a grief in me that became energy. And I had to take that energy and do something with it. Luckily, Dr. Dickerson was open to the idea that I could turn that energy into work for this community. And so we're going to talk about today how you can be a part of that work through events, advocacy, and support. This is something else I'm going to talk about. So I wanted you to open to this page so that you could think about how you could participate in our events. Events are not just a great excuse for me to rent a dress with sequins. So one of my girlfriends texted me. She said, "Oh, Katie, could my daughter borrow one of your amazing dresses for her prom?" And I said, "No, I rent those." Shh. So what we're trying to do is raise awareness, funds, and hope for FTD. Awareness is so important. My husband was misdiagnosed 8 times. 8 different medical and mental health professionals. How many of you experienced a misdiagnosis for yourself or your loved one the first time around? Yeah. Hold them up or stand up. You can shout about it. This is a friendly space. So what we want to think about is our events, like this Education Day today. The galas that we have, those are patient-centered art shows and black tie galas are a wonderful opportunity to draw attention to our community and that we're here and we want to be noticed and recognized and included in the amazing policy, research, and clinical care work focused on Alzheimer's disease and related dementias. So I want you to think about how can you support our events. Some of you may decide that you want to come to the events. The Tuberties are here today. They made our second gala like a family reunion. There were Tuberties everywhere at that event. And so you might decide that that's what you want to do and that's what's right for your family. Or you might decide, you know what? I work for the Red Sox and I could donate 4 tickets for you to raffle off. Or I want to donate $25. I'm going to have all of my family members send my birthday gifts to the FTD unit. Every gift counts. Do you know, in 2015, we raised $55,000 on gifts of less than $250. So, yeah. So when you support an event, you're supporting our work for a cure. You're supporting those creative, innovative research projects. So please send me an email. Talk to Amy Almeida. Amy, can you raise your hand? Amy is my co-chair for the Friends of the FTD Unit Event Planning Committee, and she can talk to you about how you can be a part of our gala, October 19th. So what about advocacy? I think when people hear the word advocacy, they think, oh, I'm going to have to go to the State House. I'm going to have to Google. I don't even know who my elected official is. They're not going to know what FTD is. This is going to be terrible. To be an advocate, you don't have to go to the State House, but I'm going there. We are so lucky that our community recognizes not only the importance of research and clinical care, but the importance of participating in the public and private sector to raise awareness. I feel so honored that this past October, I went to my very first National Alzheimer's Project Act Advisory Council meeting as a member of the Advisory Council. I sit in the caregiver seat, and so I have the opportunity to participate in discussions with public and private partners at the federal level about what we're doing to support Alzheimer's and related dementia. And I'm always talking about the young onset, the atypical, the frontal temporal disorders. And what I am hearing back is that I'm not the only one talking about that. You can feel assured that when we're talking about Alzheimer's disease research, you and I are included. And that's so important. And so I want you to know that when you hear about new funding, the big increase in NIH funding this year, that was for Alzheimer's disease and related dementias. We're included in that. So we're just so lucky that Dr. Dickerson is supportive of my role on that council, and that speaks to an understanding that it's going to take so much more than lab bench time to get the job done of treatments and a cure that are going to make a difference in the quality of patients' and families' lives. Advocacy is also about raising your voice. Now, get in that bag again. Look at these yellow evaluation forms. They are usually a lot less interesting than this year's. Amy was coaching me. She said, you have to tell people this is not a conference evaluation because nobody wants to do those. Dr. McGinnis was the perfect setup for me for this. Turn to the second page and look at this header. Symptom management. Please rank the top 5 symptoms in order of importance. We need you to fill out these forms. Just as Dr. McGinnis was talking about, we're not going to be able to develop effective treatments and cures if we don't know how people are changing, if we don't know what are the things that we should be targeting. And of course, Dr. Dickerson could speak to this much more technically and scientifically. But I'm here saying that you need to provide us with your story, with what's important to you, your values as a caregiver and a family. Raise your voice by filling out this evaluation sheet today so that we can start to think about developing innovative ways to track changes so that we can improve them. So, I'm going to ask you to have a working lunch. Try to fill out these forms. Talk to your table mates about it. You know, it will be, I think, an interesting way to spark discussion. What we'll do is when you turn in this completed evaluation, you're going to get a beautiful FTD pin, okay? But you have to fill out the form. Or be a vendor in the resource fair. I already gave those out. Support, okay? Go back to your white book. An email, ftd.boston@gmail.com. Send me an email, Catherine.Brandt, Megan Quimby. We know that support groups are so important. You know, I've said this before. We don't have a cure today for FTD, but we have a cure for the isolation and loneliness that comes along with this rare disease diagnosis. No one needs to wait a single minute to be connected with one another, with our community. So I don't want you to wait. Send us an email. And we're going to try to keep developing more ways that people can engage with our support group community. I like plug in and charge up. You know, we try to infuse some fun, swag bags, fancy dresses, bowling balls at our recent Strikeout FTD event, because I think that joy sparks resilience. And just because you're traveling in an FTD journey doesn't mean that you are excluded from moments of joy and happiness. They might look different than they used to before FTD came into your life, but they can still be there. And I think that we all need that. That is going to help us continue the journey, the resilience. And we can get that from support from each other. Okay, so every education day, I always have to talk about Noah, right? Because his birthday is March 29th, so I'm always thinking, well, I'm thinking about Noah every day, really. But here he is with a book that we recently enjoyed together. Noah and I have been enjoying a lot of audiobooks lately. And so we just finished A Wrinkle in Time by Madeleine L'Engle. How many of you have read A Wrinkle in Time? Okay. There are a bunch of people here that need to go to the library. You know. So A Wrinkle in Time, the premise of the story is that the young heroine, Meg, an 11-year-old girl, she has two scientist parents, and her father has set out on a research mission and gotten lost in an extra dimension of space and time. And so it is her mission to go out and rescue her father. Okay. But in order to do that, she has to engage in a tesseract. So they describe a tesseract as the fifth dimension that can shorten the distances across both time and space. And the idea is that her father is lost in a place that's so far away that to get from one point to another would take so long that she could never make it in her lifetime. And so what needs to happen is they need to form a wrinkle, right? They need to tesseract. They need to cut out the time in the middle. And as Noah and I were listening to the story, we found this idea of a wrinkle in time very interesting. He started talking about places where he would like there to be a wrinkle in time, like when I take him with me to the mall, or when he has to go to the dentist. Could he just have a wrinkle in time so it would be over? You know, I feel like I'm living a wrinkle in time with this child. Look at him. Those Christmas jammies, age 3. Now he's 10. What is happening? I don't think that I'm unique in this experience of feeling of a parent who feels like they blinked and their child has aged a lifetime. And does that mean that I am getting older? Somebody told me the other day, I don't look old enough to be to have a teenage child. And I said, my son is not a teenager, but he is tall. I don't know. So this is a wrinkle that I'm feeling a little uncomfortable about. It's going so fast. Every year on Noah's birthday, I ask him to slow down. Last year, he said, Mom, I'm not doing it on purpose. But there are wrinkles that we may want. I want to help our community figure out how Dr. Dickerson and Dr. McGinnis and Dr. Wong can help us get to the place where treatment and cures experience that wrinkle. How are we going to get from today to the treatment and cure for FTD? Where is the first survivor of FTD? I want to meet that person in my lifetime. And we are helping make that happen. We're creating the wrinkle. When you donate $1, when you find some free Red Sox tickets, when you put on a dress and show up at an event, when you think about joining me in Washington, D.C. at one of the NAPA meetings, I'll be your biggest supporter. You can give a public comment. We can make this wrinkle happen. I'm showing you this picture because we are a community that I'm a part of. And I want to share it with you because I've thought about the wrinkle in time in another way. I think that FTD creates wrinkles in the timelines of our lives because it speeds things up. Right? When Mike and I got married, I didn't think that I would be saying goodbye to him after a short decade. I didn't think that I would have to engage in elder services for my 30-year-old husband. It created a wrinkle in our lives. It sped up his lifespan. And I want to tell you that when I was here, I couldn't even see what another day would look like. And so 6 years later, this is me on February 28th, 2018, as the moderator for International Rare Disease Day, as hosted by the Massachusetts Biotech Council. We had 500 people to celebrate and raise awareness for Rare Disease Day, and I love this picture. Look at it. I've got, yes, I love it because I feel like everything in this picture, I'm smiling, I'm at the podium, I've got a pen in my hand, you can tell I'm working. And there's my name with my title. I have a title that's not just caregiver, widow. I never could have imagined this moment in 2012. I couldn't see it, and I had no idea how far away it would be if it ever came at all. But guess what? It's here. And I feel like we could have the same experience with the care and treatment of FTD. It is out there for us. And it will happen because we're all working together. It's going to take all of us. It's going to take yellow evaluation forms and appointments for research scans and waiting a long time for clinic appointments with Dr. Dickerson, but you'll still come in. But we can all achieve this together. And I just wanted to say thank you to everyone here. Thank you for helping us celebrate 10 years of the Frontal Temporal Disorders Unit. Think about what we've done. Think about what Dr. Dickerson has been able to do in the last decade. And we're just going to keep going. So, that's it. Thank you.